The human body contains more than 60 billion cells, and together, they form the tissue which forms organs like the breast. Any change or damage in the genetic material of these cells, either by environmental or internal factors, results in massive tumors called breast cancer, the second most common cancer in women after lung cancer, and one of the major public health problems worldwide. So what are the risk factors of breast cancer? In a clinical prospective cohort study, it was found that reproductive age involving events like menarche, menopause, and pregnancy confers risks that triggers neoplasms and estrogen hormone alterations, leading to apoptosis of the glandular cells and cancer cell development. However, several other factors increase the risk of genetic instability in cancer development, such as age, exposure to ionizing radiation, occupational factors, smoking, alcoholism, endocrine history, and hereditary factors. So let's take a look at some of the risk factors that affect the successfulness of cancer treatment, looking at chemotherapy and radiation. Ionizing radiation. The research report shows that patients with breast cancer have sometimes had exposure to various carcinogenic agents in their domestic activities, as well as exposure to ionizing radiation before and after diagnosis. This ionizing radiation leads to genetic mutations and alterations in their DNA. Age. From the research report, women over 50 years of age accounted for approximately 78% of new breast cancer cases and 87% of breast cancer-related deaths in the United States. Occupational risks factors. While studies have reported that occupational exposure to pesticides has an effect on the frequency of cytogenetic damage in somatic cells, occupational exposure to chemicals in women involved in agriculture or industry are at risk of basal genotoxic damages of the lymphocytes compared to patients at home or involved in school activities. Smoking. Cancer cells in patients with smoking history prior to breast cancer diagnosis were found to significantly increase at baseline and during treatment with significant changes in their DNA. Alcohol. Cancer patients with a history of alcohol consumption showed increased apoptosis levels in the buccal epithelium compared to patients who did not consume alcohol. Thus, breast cancer preventive measures include no alcohol consumption or only moderate, physical activity, and a healthy diet. While chemotherapy delivers drugs to the entire body, radiation aims to only target the specific area of the body where there are cancerous cells, and aims to reduce the number of healthy cells that are affected during treatment, which from the research report shows that subjects that did chemotherapy had better outcome than those who did radiation. Radiation had significantly more cell death across the board, regardless of the risk factor.